So I'll just start with the presbyopia, since we need to understand what exactly is this problem, and then only we can understand about the treatment. So it's a condition normally seen in the middle-aged persons in which loss of elasticity of the lens that causes defective accommodation and inability to focus sharply for near vision. So what are the principles to correct presbyopia? People start even doing with the monovision treatment. Even you can do multifocality even with the lenticular lens procedure or with the refractive procedure or bifocality. Oh, most of the people are doing even with the increased depth of focus or combined approaches. So what are all the options available in the market? Let us discuss. Let's come to the lens procedure. As you all know that you are all well versed with this multifocal IOLs, even trifocal IOLs, accommodating IOLs, and then recently one of the company launched extended range of IOLs. So coming to the corneal procedure, few of the people already started doing with the presbyopic, and today we'll be talking about presbyond and other corneal procedure which has been popular mostly in European country, that is Corneal Inlays. Coming to the sclerociliary complex modification, so some people even tried with the scleral spacing devices, even with the laser-based procedure. So importance of safe and good presbyopic treatment options. As you all know that presbyopes from majority of the patient visiting eye hospital, due to demanding of lifestyle, number of people keen on presbyopic correction has remarkably increased. Patient wants a quick results and demand for faster recovery. Cannot afford to give suboptimal results in this age group. Most of them are in active lifestyle, driving, reading, computers, etc., requiring treatment which cover entire range of vision. Can be very demanding about quality of vision. So let me just come to the multifocal IOLs. I will not be talking in detail about these IOLs. Two types, mainly refractive and diffractive, and some of the IOLs with both refractive and diffractive. So as you all know that, of course, these lenses are very intelligent lenses, but what are the disadvantage with the multifocal IOLs? As you know that, I think glare is the main complaint, late adaptation, night driving problem, even delayed adaptation, and smeared intermediate distance vision, mainly the unhappy patients. So let me come to this presbyopic, what exactly they do. Actually, it's a sort of a multifocal treatment, LASIK treatment. They do it in the cornea, mainly biaspheric treatment that induces the spherical aberration for depth of focus. But these are the problems with presbyopic. So the main thing you should see for initial compromise on distance vision, especially till 3 months. And what exactly happens, see, if you do a presbyopic in each cornea, brain will be receiving images from both from distance vision and near vision, and it takes lot time to adapt. So adaptation is the biggest problem in this, especially even patients with this presbyopic complaining of night vision problems also. And very important to note that it is a pupil size dependent procedure. So coming to cornea inlays, I think not that much popular in India, but in Europe a lot of people are doing this. Of course, I feel that one of the most popular treatment about the camera inlays, normally they do it in the non-dominant eye, where it increases the depth of focus similar to a pinhole. It is inserted in the corneal stromal pocket or under the flap. But the problems with this also, patient may come to you with a glare, and very important, reduction in the distance vision in the non-dominant eye with some amount of reduction in the contrast. So let me come to our main topic about laser blended vision. This is a unique technology from Carl Zeiss, Germany. Probably we have been doing last 3 to 4 years. What exactly we do here? We do dominant eye emmetropic and non-dominant eye myopic by 1.5 diopters. But not only we do dominant eye emmetropic and also non-dominant myopic, we also increase the depth of focus in this treatment. So how exactly we can do increase depth of focus? So increase in spherical aberration in both the cornea. Mainly we do with the negative spherical aberration in a controlled manner, avoiding to compromise on clarity. This is very, very important. So we have to create spherical aberration in both the dominant and non-dominant eye. So how much to spherical aberration to be, I think we'll come back to you. So of course, as I already said that even to create a spherical aberration, there is a limitation. So there is a limit to induce a spherical aberration to avoid the blur. So we cannot achieve complete range of vision by this alone. So what extra we have to do? We have to think about, we have to do extra this. We have to do a little bit amount of micro monovision along with the tolerable spherical aberration gives a adequate range of vision for the most activities. And adding on to that, you have to even pupil also will contribute some amount for this particular treatment. Why exactly we choose this micro monovision? As you know that in children, those are already amblyoptic, brain tend to suppress certain image from the one eye to the other eye. So it is very faster to adapt. So more natural to our visual system, allowing faster neural adaptations. Okay, some people, I think I already spoke in my beginning that some people are still doing with the monovision treatment. What exactly is the problem with monovision? Mainly about the blur zone in the intermediate zone, and they lose the depth of focus also, and a significant, most of the patient complain the significant cross blur due to anisometropia. So how, as I already said that in our treatment we do increase depth of focus, we make the dominant eye emmetropic, non-dominant eye myopic, also with the spherical aberration in both the cornea. So what exactly this blend zone is? The zone where images from dominant and non-dominant eye meets up and binocularity remains. So as I already said that there is a combination of both micromonovision and increased depth of focus by using LASIK machine from Zeiss, that is MEL 80, MEL 90, with a special software system provided by them name called CRS Master. So these are our advantage with this treatment. The patient acceptance more than 95%, and one important to note, it is not dependent upon the pupil size. So especially those are all undergone this treatment, never complain, most of the patient never complaining of night vision problem even with the glare also. So and it allows early visual rehabilitation. Patient can resume all routine activities like driving within a week. So these are the range of the power, like see, wide range of power you can do. Myopia up to minus 8.5 diopters, hypermetropia up to 5.75 diopters with the even astigmatism up to 3 diopter cylinder. Important to note that patient will have a very good intermediate and near vision. So no significant reduction in the contrast sensitivity also, and also functional stereo acuity was maintained even after the treatment. So these are our results. Actually we have done around 400 cases, but these are the 150 patients who had come more than 6 months or more follow-up. So one important to note here that none of the patient actually, none of the eyes lost more than half a Snellen's lines of vision when compared to the preoperative corrected visual acuity. Thank you. So